Hello everyone. Today, we're delving into the world of a medication called Clonidine, commonly known by its brand name, Catapres, and its generic name, Clonidine hydrochloride. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Clonidine, available as both the brand name Catapres and the generic Clonidine hydrochloride, is a medication primarily used to treat high blood pressure, hypertension. It belongs to a class of drugs known as centrally acting alpha-2 adrenergic agonists. Clonidine works by stimulating specific receptors in the brain, which results in reduced nerve signals that can cause blood vessels to constrict and raise blood pressure. Clonidine is available in various forms, including oral tablets, patches, and injections. It can also be used in the treatment of attention deficit hyperactivity disorder, ADHD, menopausal flushing, withdrawal symptoms from opioid addiction, and as part of a pain management plan in certain cases. Warnings: before using Clonidine, there are important precautions to consider. It's essential to inform your healthcare provider if you have a history of allergic reactions to Clonidine or any other medications. Additionally, let your doctor know if you have any medical conditions, including heart problems, kidney disease, liver disease, circulation problems, or a history of fainting spells. Pregnant individuals or those planning to become pregnant should discuss the risks and benefits of Clonidine with their healthcare provider, as it may affect fetal development. Similarly, breastfeeding individuals should consult their doctor to determine if Clonidine is safe for use during lactation. Caution is advised when driving or operating heavy machinery while taking Clonidine, as it can cause dizziness or drowsiness. Alcohol consumption should also be limited, as it can intensify these side effects. Before undergoing surgery or certain medical procedures, be sure to inform your healthcare provider that you are taking Clonidine, as adjustments to your medication may be necessary. Side effects: as with any medication, Clonidine can cause side effects. Some common side effects include drowsiness, dizziness, dry mouth, constipation, and fatigue. These side effects are generally mild and may subside as your body adjusts to the medication. However, there are potential serious side effects to be aware of. If you experience a slow heart rate, irregular heartbeat, severe dizziness, fainting, mental/mood changes, such as hallucinations, or signs of an allergic reaction, such as rash, itching, swelling, severe dizziness, or difficulty breathing, seek immediate medical attention. Clonidine withdrawal can also be a concern if the medication is suddenly stopped. Symptoms of withdrawal may include high blood pressure, anxiety, agitation, restlessness, and rapid changes in heart rate. It's crucial to follow your healthcare provider's instructions for tapering off Clonidine if discontinuing its use. Interactions: Clonidine may interact with other medications and substances. It's essential to inform your healthcare provider about all the medications, supplements, and herbal products you are currently taking to avoid potential adverse interactions. In particular, drugs that affect blood pressure, sedatives, and medications that affect heart rhythm should be discussed with your doctor. Dosage: the correct dosage of Clonidine is crucial for its effectiveness and safety. Always follow your doctor's recommendations when taking Clonidine. Dosage may vary depending on your medical condition and response to treatment. For the treatment of high blood pressure, the usual starting dose for adults is typically 0.1 mg twice daily, with gradual dose adjustments as needed. For ADHD or other conditions, your doctor will determine the appropriate dosage. It's important not to abruptly stop taking Clonidine without consulting your healthcare provider, as this can lead to withdrawal symptoms. Avoid: while taking Clonidine, it's advisable to avoid activities that require alertness, such as driving or operating heavy machinery, until you are familiar with how the medication affects you. Avoid alcohol consumption, as it can intensify side effects like dizziness and drowsiness. FAQ: many individuals wonder about the duration of Clonidine treatment. The duration can vary depending on the condition being treated and individual response. Your healthcare provider will provide guidance on how long you should continue taking Clonidine. Closing: that concludes our overview of Clonidine, also known as Catapres or Clonidine hydrochloride. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.